I came here to Congress this weekend for many things, but one thing was to give a podium presentation of the Cancer Warrior Exercise Program, which is an evidence-based program to introduce exercise for cancer patients to alleviate cancer-related fatigue. This is a program through my nonprofit organization, Team Inspiration. And what we've done with that program is we're trying to make it as easy and as accessible to the patients as possible. So we've created the entire program on the Team Inspiration website, and then we've mounted iPads on the wall of the hospital unit, and so that the patients can, with the assistance of the nursing staff, register for the program right there. And we have educational material for the program and for the benefits of exercise, both online and also printed material. We've also been using material from the ONS Get Up and Get Moving campaign. That is their quality campaign. Their goal is to get a recommendation for physical activity into the hands of 100,000 cancer patients. And for both of us, our goal really is just to do that, to just get the patients enrolled, get them working. For the Team Inspiration program, the online program, we first get some baseline data information from the patient, their diagnosis, their treatment, etc. And then we get additional baseline information about their physical activity level, their current physical activity level. And then we use that information to help them set a goal. We have a long-term goal, which is a virtual race. So we have virtual races on our website. We have a 5K, a 10K, half marathon, and a marathon. So that's their long-term goal. And then their short-term goal is their daily goal of reaching that long-term goal. And for that, we utilize the Oncology Nursing Society's fatigue scale. Because for a cancer patient undergoing treatment, and this is for patients undergoing treatment and 1 year out from treatment, unlike a normal or regular exercise program where you start with something and then you build to go longer or stronger, each day is a different day for the cancer patient. And one day they could be feeling pretty good, especially the beginning of treatment. Then the next day they could be feeling pretty poorly, either because of treatment or infections or that sort of thing. So the patient uses the fatigue scale to rate their fatigue, and then from that they can determine what they want to set for their goal for the day. So they've already determined their baseline activity. So let's say that their baseline activity is that they can walk 30 minutes. They've been walking 30 minutes 3 times a week. So if they rated their fatigue scale or score at like a 0 or 1, mild, they could maybe go that full 30 minutes. Let's say the next day they wake up and they're feeling very poor, either from chemo or from infection or some other side complication from the treatment or the cancer itself. They gave themselves a score of 5, that's halfway up the scale. They would just reduce their baseline activity in half, so walk for 15 minutes. So this also gives them some goal setting, some empowerment for themselves. They can decide what type of virtual race they're going to do, the distance and the time frame with which they're going to do it, and then each day set for themselves that individual goal. All of this, though, is done with nursing guidance and nursing support. So that's really the main part of the program. In addition, we do some community building. So within these virtual races, if you're enrolled in a virtual race, you can track your progress, but you can also see the other people who are racing with you. It also can incorporate some technology, some apps. So if you had a Fitbit, you can use that, or some other piece of electronics like that. If you don't have anything, you can download a free app like MapMyFitness, and then that information would go directly to your virtual race. But if you're completely old school and don't want to do that, you can do it manually. And we've kind of discussed that it would roughly be 20 minutes to walk a mile. So all of that makes it fun, puts in some goal setting, lots of collaboration between the nurses and the patient in both the educational part and the motivation part. And then in addition to that, we have an online Facebook, a closed community Facebook page where our cancer warriors participating can join. The nurses and caregivers can also be a part of that, as well as family and friends and Team Inspiration athletes who do the fundraising for the program. So that's kind of the gist of the program. And then the final piece, of course, is that we have an evaluation process and goals. And our goal is to enlist 20% of our patients in the exercise program with a 90% completion. And we can use the information that we collect up front in that database and also in tracking the virtual races to get that information. And we also have a patient satisfaction survey that the patients take, and this gives us information about whether the program's working for them, both as a physical activity, a recommendation, as well as inspirational, motivational, and building that sense of community. And then we can take that data and improve the program.